Yeah, I mean,
Swift, we about to take off.
hey, please do remain calm. About to run against it and with a little bit of soul, no times.
Welcome to the Please Remain Calm podcast. I'm Ben Gonzalez.
And I'm Daniel Gonzalez.
And we're back with another hot news show. I'm rocking our merch shirt. We do have these available for sale. Please Remain Calm shirts. You can get a merch and rescue pack where we drop a hot sticker that we also have.
We have them in sizes that fit you too, so don't be thrown off.
You know what I'm saying? I am
Don't
rocking
be thrown off by the tightness.
an L, a large. I was feeling myself. I used to rock double X and triple X.
Hey man, it happens, dude.
You know?
It's like when I go and buy size 34 waist jeans. You know what I'm saying?
Yeah, like, which I'm also wearing and, barely squeezing into them.
They fit for a few weeks, and then they don't.
Yeah.
What you
It
gonna
also
do, bro?
gives you motivation to be able to fit them again. But right now, I'm paying the price. So,
Eventually.
you know what I mean? You're going to see a lot of this move where I'm yanking on the front of the shirt, pulling it down. It is what it is.
So what's new, man? Dodgers.
Yes, sir. We're
Hell
in the
yeah.
middle of the World Series, as your hat indicates.
Bada
I know, is
bing.
that a World Series hat? That's
No,
a
it's
regular
not.
hat.
It's
Okay.
not a regular hat.
I know. I've seen people with the big-ass World Series patch.
I got one of those
hat
at home.
thing.
When I went to get it, was they didn't have my size though. It's like a half size too big.
Oh, okay.
So
Yeah.
I look like a flat biller with my
It's
ears
hard for
tucked
me
into
to
and
find fucking fitted hats,
Yeah.
bro. Yeah, I got
yeah
a giant
big
head.
ass head. Yeah,
Giant head. I've rocked an 8 before.
runs in the family. I
Yep.
think that one I have is an 8. It's just like just a bit
Oh,
too
for
big.
reals?
Yeah.
8, but 8, like you can like spin it around your head.
Yeah, you guys are going to. I just found out that my dad bought both my brothers World Series tickets and didn't buy me tickets.
Well, he didn't, and I'm also like wasn't really trying to like announce that too crazy. So thanks. But yeah, he bought them for
No, I'm just
our
kidding.
brother. Yeah.
We're all Dodger fans. You know, the whole family and everything. So we're all trying to figure out ways to go. But the game's in Arlington. You know, and we were talking about that earlier. Like if they were here in L.A., I got no problem. Me and Bernie have gone to the past 2 World Series that they had. But you know, the boys, if you guys follow me on Instagram, you know I got 2 little boys, a 10 and 8-year-old at home, well 9 and 7. They'll be 10 and 8. But I promised them that we wouldn't go to another World Series without taking them. So I'm trying to figure out paying to fly 4 people out to Arlington and then 4 World Series to. I'm like, I just can't do it, dude.
Now it's costing you.
Yeah.
Yeah, so there was another interesting thing I saw in the news, and we can get into a little discussion on mass casualty incidents here.
Oh.
'Cause that's the thing that I do at work.
And that's the thing that I do at work sometimes too.
Exactly. That's where our synergy of jobs comes together.
And they can go really well or they can go really bad depending on who's starting off.
Exactly.
Operating.
Yeah, it's a big orchestrated event, really. And what I saw in the news was the city of Whittier settled with a family who had a tree fall on them at their wedding. And this was a few years ago when it happened. And I remember this being an MCI that county fire called into us.
Oh, really?
And, we ran because,
I
it was
remember
an
that
outdoor
happening.
wedding.
Yeah, I remember that.
Yeah, outdoor wedding.
It was
at
like
a
a
park.
big oak tree or something like that,
tree.
right? Yeah.
Big ass tree.
Yeah.
And it literally fell over on the wedding party,
Yeah,
dude.
that's right. I do remember that. Yeah.
And it was like 6 people trapped, and people that they had to cut out from
Yeah.
under this tree. They couldn't do anything with this tree.
That's no joke,
Yeah.
man.
Yeah.
A big timber like that is heavy.
Yeah, dude. And I think there was 1 or 2 died. I didn't look at the story.
Oh,
for
really?
now, but somebody died.
Jeez Louise.
Yeah.
Yeah, man. That's great. That's a crazy MCI right there. It's unique. It's not something
Yeah.
you'd run into. Like normally you think about MCI and you think of like a multi-shooting or something like that, or like a big car accident or something
Car
like that.
accident is the number
But
one.
yeah, but
MCI.
tree falls on wedding party, that's a pretty unique one.
Yeah. And that had me thinking of ones that we've had that were just
Did
kind of
you
weird and random.
Were you on the phone when they called it in?
Not on the phone. I was working.
So just to kind of take it back, like if we get an MCI is a mass casualty incident.
Yeah.
Right. Typically it's 5 patients or more you would consider a mass casualty incident. And normally where we would call into our base hospital to get destinations and stuff like that for 1, 2, 3, 4 patients. When you have an MCI of 5 patients or more, we call the MEC, which is where Ben works. And usually what happens is one of the guys will answer. It's a phone number that we call, right?
Right. I mean, there's a radio also, but
Yeah.
it works a lot better over the phone.
And there's a
obviously.
radio for and there's a radio for the base hospital too. And actually, when I first got on the job, that was all we had was a radio.
Right.
Like I don't even remember if we had cell phones, but like you did not use them to make base contact. They weren't used for anything.
You were still using like number codes for the hospital.
Oh yeah, dude.
Too, right?
There's like a call station on there. You turn on the radio. There was a actual like dial-up number on the keypad that you would dial.
I mean, even when you ran like reports, like the hospitals used to be numbers for the city. I remember.
Oh yeah, man. Yeah. So now we all have cell phones. Every rescue has a cell phone.
Yeah.
You know, with cell service, and we call into base hospital when we need to, or if it's an MCI, call into MAC, and then it's kind of like we're partners. Like if I were to have an MCI and I called MAC and you answered, boom, we're on the phone together.
Yeah.
And figuring out how we're going to handle all these patients, what type of patients, what hospitals can handle, how many of what type of patient, because when we pull up, I mean, dude, we're going to get into like all this, well,
we'll do like a digested version.
Yeah.
But basically, it's going on, and it's usually on the news because something that has a lot of patients is on the local news. So we're watching it. Yeah, we're watching it, so we know like what you're referring to, what you're talking about, while it's happening. And we alert all the hospitals, figure out destinations for everybody, and get everybody going, and keep track of where they're going. So
at the MAC, is it like because like at our dispatch, which is Metro, which is at Fire Station 4 downtown, when you go into the Metro area, it's like a wall of TVs.
Yeah, they are working on that at the MAC. We have contractors, measuring shit.
Yeah,
ain't nothing up yet.
Yeah.
There's like posters, basically like we're the TVs. You're just supposed to be there long enough to know where everybody is, where everything is. So when you call me and tell me what freeway you're at, I know the trauma centers around you. I know who to hit up first.
Right.
You know what I mean? Like there's this kind of like a map in your head.
We'll pull up. Like let's just take that example. Tree onto a wedding party.
Yeah.
Unique incident. We'll probably see that come up as a I don't know, man, a fall or something like that, because there's pre-programmed things in there.
Yeah.
I'm not even sure what it would come out.
I know, right?
But it would say in the notes. Usually, if it's something unique, it would say in the notes.
Yeah.
Huge tree branch fell on multiple people, multiple victims. We're getting, and then they'll get, if it's something serious or a structure fire or something like that, sometimes they'll come back on and say, hey, we're getting multiple calls on this, just so we know, like, okay, we're going into something serious. And then every rig has triage tags. And as soon as we get there, if we see that there's multiple patients, first of all, when we pull up, just as you're pulling up, you take a look at the scene. And if you see a bunch of people laying on the ground, you can guesstimate, like, okay, shoot, I got 15 people laying on the ground.
Yeah.
I know I've got at least 15 patients. Boom, I'm getting on the MAC. And the way me and my partner have it set up is you find a spot. Usually the first rescue on scene is communications.
Yeah.
And that's a lot of times where these incidents get screwed up, right? If you show up to an MCI and you're the first on rescue and you don't set up communications right away, this entire incident is going to go to hell.
Yep.
If you just run in and people come, oh my God, my grandma, she's not breathing, and she's in cardiac arrest.
You start jumping on people.
You start jumping on. You pull your stuff on. You start working on people. The whole incident is going to go to crap.
Because nobody's established it.
Nobody's established the command system that we have in place to make sure that these things operate properly.
And we can tell at what point in the run you've called us.
Oh, really?
And we can tell if it's already gone to shit, or if we're gonna run this smooth.
And listen, I've done both, man.
Yep. You can't blame the guys for it happening. It just happens, dude.
It's easy to get dragged into doing stuff when you're the one on scene that everyone looks at as the person that can help.
Yep.
What they don't understand is that we're going to help the most amount of people the best way we can if we set up this system properly.
Yep.
And so having the being able to take a step back and say, and know that there's multiple rescues coming, position your rescue in a position out of the way where you can see everything that's going on.
Yep.
Then I get on the radio and I let the incoming units know, hey, rescue 6-3 is Medcom. just so that everyone knows. Then there's usually, if it's an MCI like that, usually have EMS captains and stuff like that that come.
Chief, yeah.
The first captains on scene will take an assessment of what's going on, and they'll order more resources.
This is now the so-and-so incident.
Exactly.
Yeah. Mm-hmm.
The truck companies will pull out, they have tricolored tarps, right?
Yep.
Yellow, red, and green. For, each tag, you go up, there's a whole system of how you do a quick assessment of people to figure out if they're going to be immediate, which are the people that we need to get out of there and treated right now.
Yep.
Intermediate, which are people that are jacked up, but they're still okay. They can hold on here while we get the immediates out. And delayeds, people that are, basically walking wounded.
Mm-hmm. That'll be a lot of times be the first thing they'll do. If there's a big pile of people injured, hey, anybody who can walk over here.
Exactly.
And now you separated people.
If you can get up and walk over there, then I know you can walk. I know you can talk. You're breathing okay.
Yep.
Come over here on this.
You've triaged yourself.
On this tarp here, this green tarp. If you're intermediate, hey, we're gonna get you out of here and get you on the yellow tarp. If you're immediate, we're gonna get all the immediates out, and if we can't get them on a backboard, get them over to the red tarp, right?
Yeah. And that's MedCom's job, is like keeping track of all those, and then you're getting all these different reports from the other medics, captains, and trying to keep all that in line, basically. And half the time that's wrong.
Right.
Like, oh, wait, sorry. We got to go out, or recontact.
Right.
Like, hey, you know what? This unit did not take this guy here. He went over here.
Well, they can become clusters very, very quickly, especially if you don't seal off the scene so that you can make sure that you don't have people, because family members will show up. You know what I mean? If it's a traffic accident or a bus, a train accident, something like that, people are calling. Oh my God! The bus just got hit by a car. Oh my God, where are you? And family members will start showing up. Different people on the street, opportunists will come and go lay down next to the tree. And I was sitting right here. So you gotta seal off the area, make sure people can't get in, right? And then you got to start triaging. You get all the triage, and then as communications, my job is to talk to you, and so there's restrictions also that we have for, like different hospitals will have what's called catchment areas where they only accept patients from this specific area around the hospital. Right. There's also limitations for like where we can go with certain patients and stuff like that. MAC has the power to lift all those restrictions, basically, right?
Right.
And then everything's wide open for us. So I would basically tell you, and I think it was John that I talked to at the at that MCI that I had with the train and the bus. Yeah. I would basically say, hey, these are the hospitals around me.
Yeah.
These are the hospitals that are around me and these are the hospitals on the outskirts that I could also take to. Let me know what they can take.
Yep.
And then with that information, what do you guys do?
Yeah, we check the hospitals.
Yeah.
Put it out on ReadyNet, and then the places that are close to you, we're not going to wait around for them to answer ReadyNet. We just call them. So, hey, we got an MCI. How many can you take?
And if it works out properly, me and you are the only two that are going to be talking to each other.
Yeah.
If the other rescues that come on scene know that I'm MedCom, there's no reason for any other rescue to call you. There's no real reason for any other rescue to even call the base hospital or anything. Everything is done through us.
The notifications that already get assigned patient and a place to go can make base once they're going.
Oh, okay.
But at the beginning or overall, don't have to.
We usually don't, man.
There's no reason.
Usually don't.
Yeah. But they should also know what's coming anyway, so it doesn't matter.
And then there's a matter of like physically setting up the incident to where like figuring out where you can have incoming rescues stage a block or so away from the incident. And then have a spot where basically one by one they can pull in.
Yeah.
Pick up a patient, you know what I mean?
Yeah.
Like
it's like an after school pickup.
Kind of like exactly, dude. Yeah. Like an 800 would come in. Hey, it's a BLS rescue. Where am I going? Hey, take one of these delayeds, and you're going to California Hospital.
Yeah.
Perfect. And I'm marking on there
that one, and we mark it down.
Yeah,
and California knows that's coming.
And just like you told me, well, California can take 5 delayeds and 2 immediates. Okay, well then I put a little hashtag next to my delayed, so I know I've already sent 1 delayed to Cal. They can take 4 more and 2 immediates. Okay, what's next? Oh, rescue, whatever, pulling up. You know, okay, you're going to take one of these immediates. You're going to county or whatever.
See, and we're keeping track of it at the same time, saying, all right, now we've moved 8. You should have 4 left.
Right.
We keep them going until we're out of people.
We're basically administrators at that point. You know what I mean?
Because the other thing, too, is sometimes that number changes. You had another one before with the Spice incident. in Skid Row,
Yep.
where we just had to keep adding patients.
Yeah, man.
It didn't end. It was like a 3-hour MCI just because you just kept finding people coming out of the woodworks that were, it was a bad batch of a drug that went out all over Skid Row, and just a bunch of people were intoxicated in the street.
Yep.
To where it was an MCI.
Yeah, man.
There was another one that was weird where the number started high and then wound up being almost like, a fraction of it.
And that happens too.
Yeah.
You pull up on something, you see a bunch of patients, you make the call, hey, I'm going to make this an MCI, you set up all communications and everything, and then you start triaging people, you realize, we got a bunch of delays and nobody wants to go to the hospital or something.
It was
like
also
that,
partially what you were saying, the people showing up to be patients.
Yeah.
You know what I mean? Because it was...
Well, I'm sure that incident on Skid Row,
Oh.
the Spice had a lot to do with that.
Yeah. We had a high school in Antelope Valley, I don't remember which high school, that had a swarm of bees go into the building, and they had like 70 patients at first from bees just flying in the classroom, stinging up.
Dude.
Yeah, you know what I'm saying? But then like by the time it was done, it was like less than 20.
Dude, we had an
Because
MCI.
there was just a lot of students like, oh I'm hurting, I'm hurting too. Yeah. Class over.
We had a MCI once. We had to make it into an MCI because essentially it was like a special needs school, right?
Yeah.
And right there on Sentinella.
McBride.
Yeah. And one of the students had brought I forget what it was, a bottle of their medication with them, and a bunch of them had taken handfuls of the medication.
I remember that.
But every kid in there was
Yeah,
altered
and
or
you couldn't
presented.
you couldn't
I couldn't
assess them.
assess who
Yeah.
was being affected by the drug and who was just normally in this state that they were in.
Yeah.
And the teachers couldn't give us anything. Well, yeah, it seems like maybe he's a little bit more tired than normal. Like, shit, okay.
Yeah.
All right, we got an MCI
Field
then.
trip.
We've got 20 patients here or whatever. We're not
Yeah.
sure who's affected by this. We're
Yeah.
not sure who took it.
I remember that, dude.
But
We've had a few other ones like that where like a kid brings in a brownie
yeah.
or something. And
Oh yeah.
12 kids
that
ate
happens
it. Yeah,
all
we
the
had-
time,
we had
dude.
multiple ones,
especially
like
in high schools, man.
Yeah.
It happens all the time.
that. Yeah.
But you have to err on the side of safety.
Yeah.
You know what I mean? When it comes to incidents like that, and MCIs are no different. Like when you show up and you see something that's unusual, you have to set up communications.
Yes.
All it takes is doing one wrong and doing one right and seeing the difference in how they turn out, man.
Totally. And
Because
that's a key a difference between ones that are done wrong and done right is when you recognize that it's an MCI and get it going as such.
Yeah.
You know what I mean?
Yeah.
If you try to start that in the middle, you're way behind the curve.
Yeah,
already.
everything's already out of the bag, and it's hard to get stuff back into control.
Yeah, especially
Once
in
that
those
happens.
situations, man. They're crazy. All right, so the guest we're going to have on today, we're going to wind up discussing cancer. So we took a jump from MCIs to the big C.
Yeah, man. It's cancer calls are kind of unique because it's not something that we get all the time through 911, at least.
Yeah, because it doesn't like present like you get things that are symptoms that are
Exactly.
caused by it, but you don't know like this is a cancer call or
Exactly.
something. It's just someone having a seizure, someone that has abdominal pain.
Right.
Yeah.
And it's a disease process, so it's not like, aside from like maybe something happening that initially caused, like I've had a patient, is vomiting blood. Okay, we show up, vomiting blood out of nowhere. Okay, damn, all right, we got a GI bleed probably, go through, check everything, check the heart, vital signs, everything. All right, let's go to the hospital. Find out later the patient had stomach cancer, was diagnosed with stomach cancer.
Right.
But short of that initial thing that happens, if you have cancer and you're going through the process of treatment, whatever it is, radiation or if you have surgery or something like that, typically it's a process. So you're being treated by an oncologist, and you have your primary doctor. And when things go wrong, your doctor's really the first person you call to find out, if is this normal side effect of the medication, of the radiation, of what. It's rare that we get called out for a cancer patient unless something, just like you said, unless it's a symptom that happened that's unusual or is worse than it normally is.
Causing an emergency.
Exactly.
But the call is the effect. It's not
right.
the cancer.
Like there's nothing we can do about the underlying cause, obviously. You know what I mean? And so it winds up being just trying to figure out how to put a Band-Aid on whatever the immediate problem is. And,
providing comfort.
and then get them to the best hospital for them. And typically when we take patients to the hospital, we always want to take somebody, it's called the MAR.
Yeah.
The most accessible receiving hospital.
Yeah.
So mostly you're taking people to the closest hospital, but then you also have to take into consideration what kind of hospital that is.
Yeah. Or where their doctors are that they see.
Well, where are their capabilities? The hospital in general, what are the capabilities of the hospital? Are they able to handle a patient like this? Do they have a CT scanner at that hospital if they're having, headaches or whatever? If they're having a heart attack, is this a STEMI hospital, a heart attack hospital? Do they have a cath lab there? You got to take all these things into consideration and take the person to not only the most accessible, but the most appropriate receiving facility.
If you are a paramedic listening at home, take note of that, because that's a conscientious paramedic making a good decision there.
And it's huge, because a lot of times, man, and I hate saying this, but it's easy to forget exactly why you got in this game. You know what I mean?
Yeah.
Like it's easy to run so many calls that you forget that you're really in the customer service business doing this job. And where you might be being run ragged with calls that day, this incident that you're having with this person, that's their experience with you today. You know what I mean? Like you're the only paramedic they're going to see today. You might run 12, 14 calls, but this is the experience they're having with the fire department or whatever paramedic agency you work for. So you got to give them the best experience that they can have.
Right.
And part of that is taking them to the appropriate facility, especially somebody who's got cancer.
Yeah.
When you have cancer and you're being treated by a team of doctors, it's not like just your family doctor. It's a team of doctors that are working with you. You know what I mean? Oncologists, and you have a medical file there, and everybody's people reviewing it. If it's a teaching hospital, they might even be reviewing it with students and stuff like that. Yeah. So all your records, all your work, all the doctors that are working on are at this specific place. And if that's three or four hospitals away, you know what I mean? Sometimes you got to just do what's right for the patient and take them to their hospital where they're getting treated.
Yeah, totally. And that's what we'll find out with our guest today. It's also not just like the doctors, but I like the ancillary staff, like other, like the nurses, the secretaries, the people that you always see for your treatment that know you and know you personally.
Yeah.
You want to get people back with them.
And nurses are the same way, especially if you know a patient, their history, if they're cancer and they're coming back to the hospital multiple times.
They know there for months or
They know
years.
the family. Yeah. They might know what comforts you, It's just better all around. And it's better for the hospitals too. When you have a patient, like let's say it's a Kaiser patient, something like that. Mm-hmm. Yeah. Like where we are in Venice, Kaiser's not close to Venice. The closest Kaiser's Kaiser West LA.
West LA.
And it's a drive to get out there, but a lot of times it's better for the patient because that's where their insurance is. Obviously, financially, it's better for them, but it's better for the hospital too, because if I were to take a Kaiser patient to another hospital and they wind up having to stay in the hospital, then Kaiser's got to pay to have a private ambulance come pick them up, transfer them over there. Yeah. Also, if you don't take the patient to the appropriate hospital, like let's say we run a 12 lead and the computer doesn't interpret it as they're having a heart attack, right? It's STEMI. You still have to take the time as a paramedic and look at the 12 lead and interpret it yourself and see if there's enough changes in that 12 lead that indicate maybe the computer's not saying they are having a heart attack, but they might be having a heart attack. Yeah. You got to take that in, because you got to use your skills and look at that stuff and make your own determination of where this patient's going to go. Because let's say you do take them to a lesser capable hospital that can't handle an active MI. Yeah. Then another rescue is going to get called out. Exactly. To take them interfacility to the appropriate hospital. Yeah, exactly. The hospital will say, "Oh shit, this person's having an MI, a heart attack. myocardial infarction, and we need to get them to, you know, a STEMI center now.
Yep.
And if there's no private ambulance available, they call 911. You know, we do interfacility transfers also.
Sure do.
For all kinds of different issues, you know. But so you have to take the time, and I'm happy to have a partner that sees the world this way too. You know what I mean? My partner Matt Cole at work, we really work well together. But we have the same kind of mindset of doing the best we can for each patient and taking them to the appropriate hospital. A good example of that, and the other thing too, man, is because I'm kind of hounding on this because it's not rare for guys to get burned out throughout the day or in the middle of the night, and you keep getting run after run, and you're just like, dude, I'm just taking you right here to Marina. I'm taking you right here to this hospital, whatever.
Yep.
You don't go to the extra step to take the person to their hospital, Kaiser, whatever. But you never know who you're treating too. No. You know what I mean? Like, I can't tell you how many times, man, I've been working on a patient, and you know, I always try to be pleasant. I always try to do all I can for patients. And then at 3/4 of the way through the incident, they go, "Oh, do you know, Steve Gomez? You know, he works at 33. Yeah, it's my brother." Like, oh, okay, cool. You know,
right, yeah.
Or I had one time we were treating this lady, and dang it, I can't remember his name. He was a LAPD police chief, became a city councilman. Black dude. Can you think of his name?
Parks.
Bernard Parks, yeah. We're treating, I was working at 57 or maybe 66s. And we go to this house treating this little old lady and you know, chest pain, do everything, you know, get her out. We're leaving. It was Bernard Parks' mom. Yeah. You know, so and he was a city councilman at the time. So you just, not that it should weigh into how you treat people, but you never know, man.
Yeah.
You never know who it is that you're treating.
Nope.
I remember one time we had I won't mention any names, but we got a call to a dress shop on Abbot Kinney, and we get there and this lady's presenting diaphoretic. She's sweating completely. Yeah. She's pale. She's kind of like lethargic, you know, leaning on this chair and kind of leaning over. She doesn't look good, and I think we got her for a chest pain. And we get there, and it's we start talking, and this gal is the daughter. She had an appointment to get a wedding dress fitted, and her mom was coming with her. So we start to get the story and stuff like that. Well, it turns out her mom had a heart transplant 4 months prior or something like that, 6 months prior.
Wow.
Before that, she had a LVAD in, a left ventricular assist device.
Yeah, assist device.
It's like a little pump that sits on there that helps pump your blood. Pretty unique thing. Not a lot of patients that have that. You know what I mean? So that immediately perked me and Matt and I's ears up. And so we do everything, 12-lead, everything, vitals and stuff like that. I'm looking at Matt, and we're like, well, where did you get your transplant done at? I got it done at Cedars. Well, Cedars is pretty far from our district. We pass a lot of hospitals to get to Cedars. But, you know, we both look at each other and we're like, hey, you know, let's go to Cedars, man. Let's take her to Cedars. Best place where, you know.
It's the right thing to do.
Right.
Yeah.
So we get her up and, you know, get her on the gurney, take her. It's a drive to Cedars. Yeah. Take her to Cedars, you know, let Metro know, hey, we're extended transport time. We're taking this patient to Cedars. Get all the way to Cedars, you know, put her in bed. She gets to bed. We put her in bed. All right, ma'am, good luck. You know, I hope everything turns out all right. And she goes, hey, yeah, my daughter is marrying, and she gives this name. It's a guy at my station.
Oh,
yeah,
man.
Dude. Yeah. So we're like, whoa, why didn't you tell us that, you know? Yeah. And she's like, oh, I didn't even think to mention it. Yeah. And, but it goes back to what I was saying before.
Yeah, dude.
You never know.
Never.
And so, you know, it's something I tell our interns and younger firemen and stuff like that get on. It's like, we are in the customer service business, man.
Yeah.
And where it shines through the most is when you have patients that have cancer or some other disease process, and they're going through it, and you see that, recognize it, understand it, and go the extra mile to make the patient's experience with the fire department or whatever agency you work for a little bit better. You know what I'm saying?
Yeah. Our guest is communicating right now. She didn't have Skype.
Oh, okay.
Yeah, she's trying to Zoom.
Uh-oh.
Yeah.
Oh, well.
See how that goes. Hopefully we get the Skype connection going in a minute.
Was she downloading Skype?
I hope. We're going to find out.
Well, yeah, man, cancer, it's like a lot of times too, man, with cancer patients, it's just like making them comfortable, you know, because it's like I said before, there is not really a whole lot that we can do. You know what I mean? But if I show up, and even if I show up and you're like, let's say, oh my God, she's, you know, this is my sister, she's got cancer, you know, she's just super lethargic and out of it today. And then we take her blood pressure and her blood pressure is, you know, bottoming out or something like that. Even if there is something that we can do, a lot of times they won't have veins. You know what I mean?
Yeah, I know.
Like chemotherapy, man, you hear about people taking chemo, man, the chemo almost jacks you up more than the cancer sometimes. Yeah. You know what I mean? Like you're essentially taking something that is designed to
it's a poison to
kill everything.
Cancer, yeah.
You know,
it wipes out everything in its path.
You're hoping it kills, you know, the tumor or the cancer that's there.
Yeah.
So you know, and it ravages your veins. Yeah. You know what I mean? And couple that with the fact that, you know, it kills your appetite. You know what I mean? So you're not eating, you're not intaking fluids as well, probably. Now we show up, you're having this problem where you're lethargic or you're unconscious because of it, and your veins are thrashed, and we have no way to even get an IV to get you fluids or medication or pain meds or anything.
Yep.
You know, or you might be in all kinds of in pain, and we have no way to give you pain medication, you know, or your blood pressure is too low for us to give you pain medication. So we would normally have to give you some fluid, get your blood pressure up so we can give you pain meds, but
you can't have to get the IV.
Can't find a vein, you know? Okay. So then there's other things. A lot of times too, sometimes when you're being treated for cancer, you'll have what's called a PICC line. Which is basically an IV that's like
big central, like permanent IV kind of.
Exactly. Yep. That's there and it's in there. It's implanted, and it's just got like a portacath or a port that's on there. You know, that's cool.
Yeah.
Which is awesome.
Yeah.
If the thing works, you know, there's a whole procedure.
Yep.
And how to like go in, hook up, flush it, make sure that it's working, that it's clear. There's no clots
because it can get infected easy.
Yeah. So, you know, so that's an option for giving fluids. That's an option for giving medications and stuff like that. But yeah, man, it's a whole. I'd say like when I show up and I have a patient that has cancer, my whole kind of we're normally giving good customer service.
There we go.
It bumps it up even more, you know, when you have a patient that's got cancer.
And there is the Skype sound. We haven't had a Skype guest in a while.
Yeah, it's been a while.
Yeah, I think since like Julie Chang probably. Hold on, I gotta tell her to turn the camera on.
There she is.
Hey, all right. Sofiya Alexandra. All right, let me give you a big warm introduction here because we weren't sure when you were actually going to bounce in. Can you hear us okay? All right, awesome. Our guest today is a comedian and host of the Private Parts Unknown podcast. She has a new album out, Father's Day, available wherever you can get a comedy album. And she is also a breast cancer survivor and good friend of ours, Sofiya Alexandra. How you doing?
Good. How are you?
Great. This is my brother, Danny.
Hello.
Hi, Danny.
Nice to meet you.
It's good to talk to you and see you again. Sofiya is
nice to see you.
Big hit in the LA comedy scene. Everybody loves her. She's an awesome person. You always see her around on shows. She's like super hustling and grinding all the time.
Yeah.
Actually,
of that is true.
The reason, none of that is true. One of the reasons like I remembered her for this show was because, I don't even know if you remember this. I think the day that you got your diagnosis, you were on Goonies. when we used to be when we used to have the bar show.
Goonies,
at,
your
Bull in Santa Monica.
your comedy show.
Yeah, not the movie Goonies.
Yeah.
The comedy show that I host and produce for years.
That's so crazy. I totally don't remember that because I think I blacked out like a lot of the cancer stuff. And so much of it happened while I was doing comedy.
Yeah.
Like I found out that I probably had cancer like on like literally a call that I put on speaker in my car when like me and a bunch of other comics were driving to like our shows at the Laughing Skull Comedy Festival in Atlanta.
Oh wow!
And I was like, I wish that was not on.
Oh my god!
Speaker.
Whoa! Did you mean for it to be on speaker, or you just didn't think you were gonna hear anything?
I just didn't think I would get any like my husband was like, yeah, it's looking, I talked to the doctor, it's kind of suspicious or whatever. So I didn't want to do that, but
that's when they were telling you that it could be.
Yeah, and it's like there's so many steps. People think you just come in and they're like, you've got cancer. It's not like logging into old school AOL at all. It's actually like a million steps. You know, it's a mammogram, then an ultrasound, then if they think it's suspicious enough, it's an MRI, then it's a ultrasound guided biopsy.
Yeah.
Then they tell you have cancer.
For sure. See, I think
it takes so many fucking steps.
How old were you when this all started?
33, 34, something like that.
Okay.
So yeah, I think when you were on our show was when you had the final confirmation. You were like, and it was weird too because I remember that was one of the one nights where I didn't stay. I had another show. So I came to set up and like say hi to everybody and we talk because you always want to talk to Sofiya if you see her. Yeah. And she just like told me and I was like,
yeah, what do you say?
Holy shit, dude. And like I didn't want to like freak out in front of you for you, but yeah, like on the inside I was like, fuck, like are you sure you even want to do this show? And she's like, yeah, fuck it. Yeah.
I mean, that was my attitude towards doing stand-up the entire time that I had cancer because I was like, I don't really have anything else. like I just want to keep that going. That and my fucking hair are the only things I held on to. And that cost a lot of money and a cold cap filled with liquid nitrogen. So.
Whoa. All right. Well, let's get into all those and like take it like from the jump. When you first discovered, you were on vacation, right?
Yeah. I really know how to ruin a vacation. So we're really.
Where were you guys?
Looking forward to going to Hawaii, and it was like the first vacation that we had in a while, me and my husband, and we were like, yeah. And I was getting in and out of my bathing suit all the time, so I was like feeling on my titties extra,
Yeah.
So I was like
you do.
Wait, like you do.
Yeah.
So I was like, wait a minute, I don't remember this. Then I was like, yo, feel this titty right here. Tell me if you remember this part.
And he's like, hell yeah.
He's like, I remember
this vacation's starting off great.
He's like, I remember this titty, but I don't remember this part of it. Like, you're right. That is weird and new. And I was like, oh, shit. Okay.
How long have you guys been married at this point?
So this was like, so we've been married for 15. We've been together for 15 years. We've been married for like 5. So this was a couple years. This is like a year and a half or 2 into our.
Oh, wow.
Oh, really?
Yeah.
Really soon into our marriage, which, by the way, is a really great coincidence because if not for his good insurance, like your girl would have been so fucked to do this.
Yeah.
It's married at just the right time.
Yeah, right?
Yeah.
It's a scary thing to think about. Really.
Yeah, really like sad because when I talk to people in other countries, they're like, oh, so you're happy you married the love of your life because then you didn't die from cancer. I was like, welcome to America, bitch.
Right?
That's
Seriously. Yeah, glad I came over here.
That's a whole nother show.
Yeah.
Thank
Totally,
God.
Man.
So basically, I found a lump and then he was like, you should really go and get it checked out when we come back. And I did. And my gynecologist did not think that it was going to be anything. He was like, printed out a little page and the textbook was like, the chances of you in this age group having cancer, like an American woman. Here's her little chart. Like, it's a super small percentage.
Yeah.
So, like, don't sweat it. I was like, okay, but my grandma died from breast cancer.
Oh.
Should I still not sweat it?
Yeah.
And
Plus,
then-
statistics like that go out the window when you're the 2% or whatever. You know what I mean?
Yeah,
like,
right. I am
hey,
feeling
that's a
this
great
lump.
that's a great statistic you're giving me. But
yeah, that's one thing that you learn about like percentages and statistics when you go through something like this.
Sure.
It's that like none of that matters whatsoever.
Exactly.
It's just you really have no idea if you're going to be the person that gets the really bad side effects or not, if you're going to be the person that caught the cancer early or not. Like all of that is just so up in the air that you really like, the more you go through the process, you're like, oh, this is like a brutal way of learning that like the only things you control in life are like the things that you control, like people in your life, how much you give to them, love, what you do with your time, you know, friendships, that kind of shit, you know?
Yeah.
And you like realize all this other stuff you can't control at all. So, and the other thing that's kind of like sad, but also kind of funny is I had the genetic test, the BRCA gene test that you can get to see if you are probably going to get, breast cancer. Like Angelina Jolie had that.
Sure.
She's the one that popularized the test.
Right.
And a lot of women choose to then have like a mastectomy or have their ovaries removed if there's such a high chance
right?
they get it. Yeah. Because, you know, nobody wants to go through the pain and the hassle and all that of actually going through cancer. They'd rather go through the surgery, or a lot of people anyway.
Sure.
So I got the BRCA test like maybe a month or two before I found my lump, and I was negative.
Oh, wow.
Wow.
So you're already feeling good about it, and this kind of just came out of left field. Okay.
So I guess the moral of the story is there's plenty of cancer in the sea.
Yeah.
Yeah, right?
And you never know.
Even if the kind you got tested for, you're negative for.
Oh, you counted your cancer chickens now.
Yeah, before they
right?
hatched.
Man.
And like, if you're listening right now and you found a lump, just go get that shit checked.
Yep.
You don't risk it. You know what I'm saying? Just go get it checked.
Because especially if you just got those results, it would have been easy to be like, this probably ain't shit.
Exactly.
We're in Hawaii.
I wanted so badly for it to not be anything. I didn't want to go in. And after he said, you're probably fine, and gave me the printout, I didn't want to keep going either. I was like, well, that sounds good. Should I just fuck off, you know?
Yeah.
So the next step was to get a mammogram?
Were you feeling any symptoms at that point, or was it just the lump itself was the only red flag?
Yeah, no symptoms whatsoever. Just a lump.
Was it painful?
Nope.
Nothing at all. Just boom, lump.
Most of the time, the lump is not painful.
Okay. Okay. And then, so what was the next step after seeing your gynecologist and him making you feel better about it?
The mammogram was really like dumb because if you have dense breasts, not to brag, but if you have dense breasts, basically they can't see shit. So it's just not really conclusive. So if you're, again, listening, I would insist on a 3D mammogram if you can, so you just don't waste your time. And a lot of younger women have dense breasts. That's kind of how it goes. So, yeah.
That was going to be my next question. Like, has science tackled the dense breast problem yet?
No. I mean, the 3D mammogram is a really good step, I think.
All right. We're on top of it.
Yeah. Learn something new every day.
Yeah.
But mammograms are so painful. I don't think guys realize they squish your titty into like a patty this small. I'm not even exaggerating.
Yeah.
Your girl is an F cup. They made this into like the size of a grilled cheese sandwich. I cried.
Man.
Is it getting like fed in, like smushed like by the nurse or technician or something?
Like
how does it
press, right?
Does it suck it in?
It's plates and you put your
it's like a car crusher?
And then they literally compress it like a car.
Yeah.
Wow.
So if you're going to go through it, you might as well do the 3D.
Do you get like lidocaine or something over them first or nothing? They're just like, take it?
No, they're just like, sorry, you were born a woman. Squish.
Wow. It's this or the cancer.
How often are you supposed to get, are you supposed to get a mammogram regularly after a certain age?
Yes, you are. After a certain age, you're supposed to get one like every year, I believe, or every couple of years.
Oh, really?
Fuck.
Yeah, so
you're
and
up,
then
dude.
when you find out that they're mostly inconclusive and they just been squishing your titties for nothing,
Yeah.
that shit'll make you mad, you know?
Wow.
So
Wow,
yeah,
okay.
and then they were like, you need to get an ultrasound, and I did, and the lady, like, or no, maybe I did the MRI for whatever. I think it was an ultrasound then MRI, but the lady who did it was like, this, is what it looks like if it's normal. This is what it looks like if it's suspicious, or this is what it's like, She's like, but it probably is fine, And then I was like, well, my grandma died from breast cancer. And then she's like, oh, okay, well, maybe we'll upgrade it to the next level.
All
And I was
right.
like,
Okay.
okay, maybe. So then I got the breast MRI, which is also horrible because you lay on your stomach and your tits go through these holes in the table.
Whoa.
And your arms go like up here by the sides of your head. And you lay face down and you're you're like inside the machine. So it's the most claustrophobic thing in the world. You're in there, all you can hear is a super loud like clanging.
Yeah.
It's like an old school modem, like times a million.
Yeah.
And you're in there for like 45 minutes and you kind of start to freak out. And they keep saying, don't take any deep breaths. And you're like, well, the only way not to freak out is to take a deep breath.
Yes.
And they're like, if you take the deep breath, you're going to move your titties and we're going to have to make you be in there for longer. And then you start hyperventilating. They're like, no, don't do that.
Oh my God.
You're like, this is a fucking nightmare. So the first time, and you hold like a little thing in your hand that you squeeze when you want them to, when you can't handle it, you need them to pull you out. I was in there for 2 minutes the first time before I was like squeezing it.
Yeah.
I was like, this is fucking over. And they go, are you sure you want to come out? And I was like, I thought you said squeeze this if you need to come out, not to have a discussion.
Let's talk about it.
Ready to get the fuck out of there.
Oh
so,
my God.
Yeah. And then they were like, oh, well, this happens all the time, actually. Most people really freak out in there. And then they have to make another appointment and come back with an Ativan prescription. I was like,
Dude.
Why don't you tell us that shit in advance?
Whoa.
Yeah, I guess
all of this is a nightmare is what I'm telling you.
Have you had an MRI before?
Yeah. I don't really, because they have open MRIs too, right?
Where they do.
But
I always just thought those were really fat people.
But
yeah. I've had it for my back, and yeah, I could not imagine being prone in an MRI machine, dude. It sucked being on your back, but at least it was like, okay, it's like a coffin. All right,
yeah, it seems impossible if you have any kind of anxiety or claustrophobia.
But prone, dude, like I would not want to be just on my stomach in that tube, just face down. You know what I mean? There's something like worse about not feeling like you can look up.
And I don't think you realize how like also claustrophobic and weird it is to have your hands by your ears. Like stretched out
that
like
too,
that
because
for 45 minutes, like you never do that. It feels so strange. Wow. And the only thing that like made me feel better is when I found out that you can get that kind of same MRI that I got, but at a place that'll play music for you while you're in there. So the next time I came back to a different place with Ativan and with like my iPod, and I was like,
ready
just
to
plug
rock.
this thing in. I can do this. And then I did it.
Yeah, that's cool. And not hear that pinging. It is music, kind of like the beginning of a Tool song.
Yeah.
So, I had them play Phantogram, and it was like perfect to drown it out.
Nice.
So once you were diagnosed, what was the first step toward treatment?
So they do surgery really soon, like pretty much ASAP, within a couple weeks from being diagnosed. Okay. So the thing is like when they take out the lump, they then know what kind of cancer you have. When they take the biopsy,
biopsy.
Sure,
they don't completely know. So when they took my biopsy, they thought it was just the kind of cancer that I didn't need to have chemo for.
Okay.
So I was super psyched. I was like, oh, this is going to be no big deal. And then when they took the whole tumor out, they found out that it was triple positive, which means it's positive for progesterone, estrogen, and HER2 receptors, which make you a really good candidate for chemo. So it's good for treatment, but bad for not for wanting not wanting to have chemo. So that really is the thing that destroyed me. I really was
the chemo.
Yeah, I was okay before they told me I had to do chemo. Yeah. And then I was like pretty fucking brutalized because I just knew how hard it was going to be. And I had no idea, that was an understatement. So I just was like, fuck, I don't want to do chemo. Like, how am I going to live my life, And and then that's when I told my mom and family and stuff, because I didn't want to tell her until I knew all the details. Like, I knew it was going to be really traumatic for her. I'm her only kid. She's a single mom, and her mom died from breast cancer.
Do you remember your grandmother going through treatment for cancer when she passed?
So I remember helping her put on a bra and seeing that she had like just nothing where her breasts would have been, just like scars. Yeah. I remember that. And then I remember when she was going through treatment, like towards the end of her life, when it had like metastasized, and then they were like, well, we can't really do treatment, she's too old. Sure, and then that's how she passed. And she died on 9/11, and I could not fly out for her funeral because 9/11, and I was in Washington, D.C. So it was like, cool.
How many
tragedies can we pile up at one time?
Wow.
Yeah, I'm sure that added to your mom's worry, though, once you finally told her, And
I just want to tell her until like we had a plan and everything, and I had like talked to the oncologist and been like, okay, so first things first, we get the lump out, and then they take some lymph nodes out from under your armpit to make sure that it didn't spread.
Sure.
So that's called a sentinel node biopsy. Mm-hmm. And mine was clear, which was great. And then after that, I had chemo. I had 12 treatments. The first 6 are like the really hardcore chemo.
Yeah.
That really like just devastates your whole system and is like poison essentially. And then the second 6 were, the chemo was just of Herceptin, which by itself isn't as like, it doesn't knock you on your ass. You can still kind of live your life. Mm-hmm. And then I was getting that while I was getting radiation, and I had 28 treatments of that.
Were the chemo? I'm sorry, the chemo was like once a week, and radiation was once a week, like alternated, or?
No, chemo was once every 5 weeks.
Okay.
So you come in, and it's like a whole day.
Of them just giving you the
infusion, yeah. So, like I would be there. Yeah, and they give you like steroids immediately. So then you feel invincible for like 2 days.
Really?
And then you crash horribly. And then you get an acne beard, and you get like as good as you felt when you were on the steroids is how terrible you feel when they're off.
Oh, really?
Wow.
'Cause they're there to get you through the hardest bridge, kind of. But then it's hard. So and when you get chemo, or the kind that I got, which is TCH, it's like one of the things that can happen is it can make it so the nerve endings die in your fingers and your toes.
Oh, wow.
And how they prevent you from getting that is they tie ice packs onto your fingers and your toes.
Really?
While you get the infusion. So you're sitting there from like 7:30 in the morning to like, when you're done at 5 p.m. or whatever with ice packs on you.
Just so the chemo doesn't reach your capillaries there, I guess?
Exactly.
Yeah. Wow.
And that's how I kept my hair too. I didn't keep all of it. I kept like half at the time.
That's what you bet.
But yeah, so you wear like this cold cap, which is, it's like they spray your hair down completely wet. They put like a rubber cap on, and then the cap that they pump the liquid nitrogen through.
Wow.
And these tubes are like connected to this thing. And you basically sit there with that on you for the entire time that you have the infusion. So again, from like 7:30 in the morning to like 5 p.m. Wow. And it's one of the most uncomfortable things in your life. The first time I got it, I almost threw up from how cold it is.
Oh, really? Yeah.
Because when they take it off, literally you have snow in your hair.
Wow.
Like you go like this and literally chunks of like snow come out. So it's wild and a lot to go through. But Ben, you know how hot it is when you're on stage doing stand-up anyway.
Yeah.
I was like, as much as I wanted the idea of like, I'll just wear wigs, I was already so fucking hot. Then you're in menopause because you're taking all of these hormone blockers. So you're having hot flashes. So you're just like completely pouring sweat all the time. I was like, I can't do this. So I just wanted to be able to be myself more or less when I went up. You know, it was already going to be hard to not be like, I have cancer, feel sorry for me, because people, that's what they do when you make cancer jokes, even if you're okay with them, you know? Right. So I was like, I at least want to look well so that they aren't like worried about me, you know?
Yeah. I don't really remember you doing like cancer material though, when I saw you since.
I did a bunch. I was doing material about how like people tell you you're like a hero.
Oh, okay. No, I do remember that because I think most of the other stuff when I saw you was like you running the stuff for your album.
Yeah. That was probably it. Yeah.
Were your doctors pretty optimistic about your prognosis throughout the whole thing? Was there ever a time when they didn't know and they let you know that, or was it always like, hey, you stand a real good chance of beating this? Like, were they trying to keep you positive the whole time?
So thank God it was stage 1. And they let me know that was really lucky that I caught it when I did. Mm-hmm. They are really good about saying like, you're not going to die, you know, you're going to be fine. So just remember that. And it's hard because a lot of the time the things they say to you can seem kind of cold, but then you realize that they're dealing with like people who have stage 4 metastatic cancer.
Sure, yeah.
Right.
That they have to save like their actual emotions and grieving for. Whereas meeting me, who found it early, who's in her 30s, it's like, okay, well, like you are the luckiest unlucky person we deal with. Yeah. So like shut the fuck up a little bit. You know, they don't say that.
The perspective's different. Yeah.
Well, me and Ben were talking about that before you called in, just about how you have to keep each individual person that you deal with, even, you know, as a paramedic. I might run, you know, 5 or 6 chest pains in a day, and you might be the, you know, the least severe, but it's still your only interaction with a paramedic that day. You know what I mean? So I always try to make sure I give everybody the same type of care that I would get. You know what I mean? I try to be as caring and as straightforward and honest with everybody, you know. And I would imagine it's the same with the doctors. You know what I mean? Like it's easy to forget that, even though you are the least, you know, you're in stage 1 and they're dealing with all these other. It's easy to forget that this is your experience with cancer. Yeah. You know, that even though you're the least, you know, you're stage 1 and you got a bunch of their stage 4, you're still dealing with stage 1 cancer, and it's still scary for you.
Yeah, I do feel like just like cancer doctors operate on a different level.
And that's true too.
It's like you just don't really like, until I would come to my chemo sessions and then walk around, you know, everyone around you is also having chemo, and then you see all the different levels and stuff. And all the different things that people are dealing with. And some of them you can hear like moaning and stuff like that. And, you know, I was so miserable when I had my infusions also, but it doesn't make you feel like you have it that bad when you see other people.
Sure.
And at the same time, it also makes you really feel for them, which is one reason that I never did any cancer support groups, which I'm not saying I recommend to other people, but I was like, it's hard for me to tell other people that I have cancer. Yeah. Like it's hard for me to hear. It's even like, I don't want to, after I'm like sitting in my fucking cancer all day, to go to this group and listen to your cancer.
Yeah, exactly.
I'm like feeling so bad for you also. Like I can't do this.
Yeah, it becomes
so
too
I
much.
Didn't do it. Yeah. And I feel like maybe it's the same with the doctors, where they're like, we see so much pain every day that this disease is like caused. The only way we can just do as good a job as we do and keep it like pushing and whatever is if we reserve some part of our feelings and whatever to ourselves, you know?
Right.
But the nurses that I had, like the nurses that you have when you're going through chemo, the ones that are good, you're going to remember. Right. And you're going to literally like ask for them when you come in, because the difference between someone, you know, treating you gently and someone who is just not very good at what they do, you stop having patience for that. Because I had needles stuck in me so many times over the last 3.5 years that you stop having patience for people who are trying to figure out how to like get your blood or whatever. You're like, you know, not that you would ever be rude, but you know, I learned how like by my third chemo or whatever to be like, is it okay if you ask, you know, Brittany to do my IV? Yeah. Just, I love her, or you know, not in a mean way, because I've taken pictures of my hands having, you know, giant blood fucking, you know, bruises from people who don't know what they're doing. And you're like, well, I already have a chemo port that I had to get surgery to get input inside my arm right here. You know what I mean? Yeah. And I'm in pain all the time from all of this other shit. Like, please just let this be painless, you know?
Right.
And then just people saying things like, hey, there's this cream you can put right here that's going to numb the area where your chemo, where the needle's going to go for your infusion. And you're like, oh, thank you so much. Like, people don't tell you all the shit, you know, and the ones that do will stick with you.
Yeah, that's awesome. That's also part of advocating for yourself.
Sure, yeah. You know? Did you use any, just before we go here, did you use any like homeopathic remedies or anything to help with like, did you smoke weed or use any like edibles or anything to help with appetite or pain relief or anything like that?
There's this stuff that looks like it's like black tar heroin, and it comes in like a syringe. And it was developed by a guy that I think went through cancer for cancer patients. Mm-hmm. And you like eat it. It's like sticky, gross, almost tar stuff. Yeah. But you eat it and you don't have to smoke it, which is great when, you know, you're going through treatment. Sure. And it gives you appetite, and it also gives you like a relief from anxiety and the like positive things that weed gives you, but you're eating the whole plant, I guess, essentially. Oh wow. In a concentrate, I guess. Yeah. So if you ever see one of those syringe things when you're at a place and you're like, what the fuck is this? That's what that is. It's for cancer patients and other people that have pain disorders, and it's pretty great.
Wow. Okay. All right. Cool. Well, this was full of useful information.
Yeah, it really was.
Sofiya, you're awesome. Thank you for coming to talk to us.
Damn.
No, it's not really a funny podcast.
Bro, that's like the struggle with me doing this show. I know. And like wanting to jump in with more jokes, and sometimes like, no, dude, this isn't the time. Because it's hard to fucking do something where like you're not going to be funny the entire time, you know?
You should have jumped in with jokes more, honestly.
Yeah, I know. But we had to get you out there. But really,
I appreciate you.
There was a lot of stuff a
lot of good information. I think you shared a lot of good information.
Didn't know about breast cancer.
Well, it's good for me
about mammograms.
Good for me to know about good for me to know being a paramedic, because like I was telling Ben earlier, I do run on cancer patients here and there when you know, having chemo, or you know, their blood pressure drops at home, or you know, sometimes they'll get GI bleeds or different things that happen that require emergency transportation. But you gave some good information. I think anybody that's listening that, heaven forbid, you know, might find a lump or something like that, I think everything you gave was really great info. Yep. Really appreciate you coming on. I know things like this are hard to talk about, so thank you so much for joining us.
I have one final tip.
Yeah.
So when you get radiation, they the first day you come in, before you come in for the official radiation, they like map out your tit to like make sure they give it from the right angle and whatever. And they tattoo a little dot to orient themselves in between your tits. Fun fact, that shit is optional and they won't tell you. They will just be like, okay, now's the time for the tattoo. And you go, pardon? I didn't fucking know I was getting tatted up in this bitch. What are we, prison? And they go, oh, tats? Yeah, they're like, we do this so that we can orient the thing. And you're like, okay, well, but I just saw you did this on a transparency with a marker. I'm like, can't you just use a permanent marker?
Yeah.
They're like, well, it's just going to take extra time every time you come in.
You know how many dots we're going to have to do?
And I go, okay, how much extra time? Yeah. And they go, like 10 minutes. You
the nerve.
To tattoo me for an extra 10 minutes?
We keep the markers down the hall. You got to get the keys.
Oh, man.
That's crazy, dude.
Next time someone's like, let me tat you up real quick. I'm a medical professional. Be like, could we try a marker?
Skepticism.
Good advice.
Is your friend. Plug your stuff, Sofiya. I did a little plug at the beginning, but jump on again.
You are great. You can find me on Twitter and Instagram at the Sofiya, Sofiya. You can get my album anywhere you get comedy albums. It's called Father's Day. It's a bop. It was #1 on iTunes.
Congrats.
Thank you. Yeah. And I got podcasts. So, follow me and check that shit out.
Yeah, her podcast is a trip.
Yeah, I gotta check it out, man.
Oh my God, we just did an Ashley Madison episode.
Oh man, all right, I want to check that out then. I mean, like, it's a trip. Like, she's been to the Doc Johnson's factory, like the sex toy factory, and had herself molded. Like, her podcast is trippy, dude. Nice.
They molded my vagina. It's awesome. I still have it. It's really cool.
All right. Well, thank you very much. We love you. We appreciate you coming on.
I love you. Thanks, guys.
Thank you. Thanks. Bye.
Just brothers in showbiz. Bye.
Thanks. Plug yourself, sir.
You can find me at DannyGonzo34 on Instagram and Twitter.
You can find me at Ben9Humor, Ben9Humor, like benign humor on Instagram and Twitter.
As always, the opinions expressed here are our own. They do not reflect the opinions of the Los Angeles Fire Department or the Los Angeles County Department of Health Services.
Follow the show at PRCPod on Instagram and Twitter, and email us at contactprcpod@gmail.com if you have questions about the show, or if you want one of these hot T-shirts or our hot sticker.
Or if you know anybody that you think would be an interesting story to tell on the podcast.
So we don't run out of guests.
We're always on the lookout for more guests. We only know so many people.
Like, how do you know that many people that got fucked up?
But I get people that come up and say, hey, you should hit up this person, hit that person. Send us an email and shoot us an email with some contact info, and we'll look into getting it on the show.
Thank you very much. Thank you, Third Wheel Podcast Studio, and we're out.
We're out.